The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Jump into some Q&A questions here. Dr. Gill, in your experience, this person wants to know, what is the best way, medical or non-medical, to treat an enlarging prostate in men?
That's a great question. So there's no best way, there's no one size fits all. And it's not a hedge of not avoiding the question. It's an honest answer. The best way to treat it is matching the right treatment to the patient's priorities. So, some men don't want to have procedures. They'd rather use medications. Some men would rather try lifestyle modifications first. Some men come in and they don't want anything to do with pills. They just want to cut to the chase and say, hey, why don't you go in and open it up and clean it out? So for me, the best treatment is the one that I talk about with my patient and that we kind of, decide together is the right thing for them. And then as mentioned, I strongly recommend, and I usually require a workup so that we know the shape and the size of the prostate before we make a treatment decision, because some shapes and sizes of prostates will not benefit from some of the procedures and treatments that are available. You really have to match the right thing to the right prostate.
For sure. Great points there. Alrighty. Interesting question here, but I think this is pretty great as well. So this person wants to know, does riding a bicycle with BPH increase your PSA?
Great question. So, this is another one of those kind of joking discussions I have with patients when they come in the office. Every year at our big urology meeting, somebody sets a presentation up and says, hey, cycling increases the PSA. And then the next year at the meeting, somebody gives a presentation that says, cycling doesn't impact the PSA. And they just go back and forth year after year after year. It's not exactly like that, but it's not far off. So cycling, depending on the type of seat that's used, if it puts a lot of pressure on the prostate area, it may cause the PSA to go up a little bit. That being said, one of the big things I tell patients with PSA testing is I never worry about a single PSA value. I always recheck it. So if you are a big cyclist and your PSA is up, take a break from cycling for a few days, have your team repeat a PSA for you and see what's going on. The important thing with the PSA is its trend and how it changes over time. A single PSA value is not worth a whole lot in terms of prostate cancer screening.
Next question here. This person says they're scheduled for a prostate surgery soon, but have gotten relief from pumpkin seed oil. Have you heard of this before?
Yeah, so there's a number of different supplements that are out there that have some research that suggests they may benefit BPH and bladder symptoms. Pumpkin seed oil is one. The most well-known is something called saw palmetto, and that's sold over the counter as saw palmetto, but also as a number of different branded supplements from different companies, stuff that you'll probably see on late night TV ads. But those supplements may have some relaxing effect on the prostate. They may have some anti-inflammatory effect on the prostate. The challenge, though, when it comes to supplements versus medications is medications are regulated by the FDA, supplements are not. So we don't necessarily know how potent or how strong of a dose of whatever active ingredient in that supplement a patient is getting, because there can be some variation from company to company, from batch to batch within a company. So sometimes there can be some inconsistent results with supplement use, whereas medications, because they've gone through FDA approval and everything, phase 1, phase 2, phase 3 trials, we have a pretty good handle on what to expect in terms of effect from them. But that being said, most supplements for prostate health, there tends to be very little downside aside from cost to using them.
Alrighty. Next question here. I saw this a couple times. This question is, short of surgery, what can I do to reduce frequent and urgent urination?
Great question. So I always start with setting expectations with patients. We're supposed to pee every 2 to 3 hours. That's normal for the bladder. At a very young age, society teaches us differently. Think back to when you're in grade school, right? You have your hand up. No, it's not time for a bathroom break. Finish your assignment. But we're supposed to pee every 2 to 3 hours. So that's the goal I always try to work with and get patients to. Certain things will irritate your bladder and cause urgency and frequency. Those things are caffeine and alcohol. Most adults are fairly familiar with those. And then sweeteners, flavorings, and colorings. Caffeine, alcohol, sweeteners, flavorings, colorings. Those 5 things are what I consider to be the bladder irritants. And then other things that also worsen bladder symptoms are constipation. If you can get a handle on those things, you'll probably see your bladder calm down. You'll be able to hold your urine better and not have to rush to the bathroom as much. One of the things I'll ask patients to do is take a week, take 5 days, and if you're thirsty, drink water or just plain milk. If you can't drink milk, obviously don't drink milk. You'll cause yourself an upset stomach. But sticking to things like water and milk that don't have sweeteners, flavorings, colorings, caffeine, and alcohol in them will help your bladder relax, help you hold your urine better, and not have to rush to the bathroom.
Okay, let's move right along. Next question here, another review, but pretty great question as well. What treatment options have the least side effects for erectile dysfunction for a prostate treatment?
Side effects in terms of erectile dysfunction?
So I guess this person, considering prostate treatment, and they're looking to mitigate their ED after.
Oh, yeah. So erections and leakage are 2 things that we talk about with any type of prostate treatment, whether it be for cancer or BPH or really anything. When it comes to treating BPH, I always fall back to the watermelon analogy. We focus in BPH on the pink fruit in the middle. That's the part that clogs it up and makes it hard to pee. The green skin on the outside of the watermelon is where the nerves are that produce erections. So in a BPH treatment, in a procedure where you're staying within that pink fruit of the watermelon, you actually have the whole white rind in between you and the green skin. You shouldn't impact that at all. So BPH treatment nowadays, because we're more precise, we have better visibility, we have cameras, HD cameras in the operating room for our scopes, things like that. The rates of erection problems with BPH procedures is exceedingly low. I tell my patients in good honesty, it's not something I'm worried about going in and doing a procedure for you. Those rates of erection problems with the in-office treatments, like the implants, the steam treatment, the water vapor thermal therapy, Resume, the little temporary implant, those type of things, there really have not been any reported cases of erectile dysfunction with any of those. Medical treatments, the 5-alpha reductase inhibitors, the alpha blockers, there's mixed signals in the literature in terms of those potentially worsening erections. That's a hard one to kind of weigh in on. However, those medications, once you stop them and they're out of your system, their effect is gone. So, if you do notice things in the bedroom aren't what they used to be after you start a medication for BPH, you can always stop it. Daily Cialis for BPH treatment, in no way should that make your erections worse. If anything, it may actually make them a little bit better.
So I guess a follow-up to that we just received in the chat would be this following. Tadalafil appears to be shown as both an alpha blocker and an alpha reductase, as we just mentioned, to treat BPH. From the slides, the only difference appears to be the size of the dose. Is this accurate?
So tadalafil is a phosphodiesterase inhibitor. It's a completely different class of drugs. It's not an alpha blocker. It's not a 5-alpha reductase inhibitor. It doesn't have anything to do with those. It's a phosphodiesterase inhibitor, and what that does is actually blocks the breakdown of nitric oxide, and then nitric oxide causes muscle relaxation in areas of the body. So that's how the prostate and the bladder relax because of tadalafil.
moving right along. So next question here. This person wants to know, what is a PAE, and is it an option worth considering?
That's an excellent question. So PAE, or prostatic artery embolization, is a procedure that's done by radiologists, not by us urologists or surgeons, where they block up the arteries that feed the prostate gland. And what happens is, with the blood supply to the prostate being occluded, the cells eventually die off because they don't have blood flow and the nutrients they need to survive. And then gradually after that procedure, the prostate shrinks up and it opens up some. Prostate artery embolization, because it's done by radiologists, we don't know a whole lot about it as urologists, because patients will tend to go in, they can have treatment with the radiology team, but then maybe they follow up with their urologist. And there's not a lot of great research out there for us to look at to really understand what to expect from prostate artery embolization. It is great for certain situations. If there's a patient who, has a bleeding prostate, they can't tolerate anesthesia, that procedure, PAE, can be done with a little bit of sedation. It's not very invasive. It does require sometimes an hour or two of laying on the x-ray table. But that's out there. It's something that us urologists know and we appreciate. We're just still learning more about it and really how it stacks up against the other treatments that we regularly use in our hands.
Got time for a couple more questions here. Next question is high pressure water ablation a good option for a procedure, and what can I expect?
Great question. So the robotically controlled water jet ablation, one of the newer treatments that is out there, just like any of the other BPH treatments, it's only good for certain prostates. Prostates that are really, really, really big, not a great idea. You have to be very careful with it. If a prostate hangs really far into the bladder, it has what we call a median lobe. And then one of the other things we think about with it is it's not great for patients who need blood thinners because of the way that it works. That procedure, though, like the other surgeries, is usually an overnight stay in the hospital. Some men can go home the same day after that procedure. There tends to be fairly bloody urine just by the nature of it. And then recovery and symptoms, again, very similar to the other procedures where you're clearing out the tissue in the prostate. There's some irritation there for a few weeks, maybe peeing a little more frequently, a little blood in the urine, things of that nature. But yeah, that's kind of a cool treatment. We're learning more about it, as time goes by. It'll be interesting to see what the long-term durability of that is.
Alrighty, one final question. I think this is a good review and probably there's a variable answer, but what PSA number makes someone a candidate for a surgical procedure?
Great question. There isn't one. So there's no such thing as a normal PSA. Just because you get a PSA test and your lab, it gets highlighted as being abnormal, doesn't mean that it's abnormal. What's important with PSA is how it changes over time. Some men may have higher PSA levels their entire life. Maybe they sit at a 5, 5.5, and just kind of hang out in that range for years. Other men may have very low PSAs. It could be 1, 1.2. Gradually over time, it creeps up to 2 and to 3. That situation, I would say, is actually more concerning than the guy who's spent his life sitting at 5. PSA and how it changes with time is the most important factor. As a general rule of thumb, a factor of 10, if your PSA is 1/10 of your prostate size, so if your prostate is 40 grams, a PSA of 4 is considered to be very reasonable. That's something we call PSA density, and there's some value to that. But I always still fall back on what happens to the PSA over time. If it's steady, if it goes up very slowly with prostate growth, that's fine. But if we ever see it go up quickly or go up faster over time, then that's where we get concerned prostate cancer may be present. No, thanks for the opportunity to engage with everybody. Us guys, in terms of our health and just men's health in general, we need to do a better job talking about things. So, this is a great opportunity. Hopefully I've helped you learn a little bit more about the prostate, what's involved with BPH treatment, how PSA plays into that, prostate cancer, and all those things. Make sure you're getting your prostate cancer screening. Talk to your buddies, talk to your loved ones, make sure they're getting their prostate cancer screening done too. Thank you.
If you'd like to learn more about BPH or an enlarged prostate, there are more resources in the Resource Center on menmd.com. You may visit this page to view instructional videos, guides, expert articles, and more. If you'd like to compare any of the treatment options we've covered during tonight's event, you can do this by going to menmd.com, navigating to the BPH condition page, scrolling down to the treatment section, and selecting up to 3 BPH treatments to compare. Your next option is to call MenMD at 857-233-5837 or log into the password-protected secure MenMD portal to schedule an appointment with a MenMD personal health assistant. To learn more about the green light laser or resume treatment options you heard about and saw tonight, please visit resume.com. You can find more information there as well.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.